How common are cases of Alzheimer's like hers?
Unfortunately, there are no statistics. There's nobody who knows about it. So when we were writing, what made me actually even get involved with studying Alzheimer's is because I had to do a paper and we were told to write about something nobody knows about. I was doing psychology then. And so I decided to write about this disease called Alzheimer's. And interesting enough, even the counselors in the class, most of them did not know what it was. And because you had to give in a paper that had numbers, statistics, how many people in Kenya have the disease, there was nowhere where we could get the information. So most people, I think you will see somebody presenting, like she said, initially they thought it was stress and depression. And because they present like stress and depression before, but as you continue with stress and depression, you cannot forget somebody's name, you will not forget who your children are. So it's a different, it's not stress and depression, no, it's not the normal way of aging. This is a disease. So that is why we actually, for me, what I was actually looking for was more of a support group where we would get people to come in together and help each other. Because if you hear, I have gone through it and this is how it helped me, by speaking out and telling somebody else, then you hold somebody else's hand, then you're able to have more people speaking about it, because most of the people we know are either keeping quiet about it or you do not understand what is happening to your loved one. So you either lock them up somewhere or just go quiet about it. So the numbers are not there. Not many people know about it.
All right, Salome, how come we don't have statistics on this?
Worldwide we have statistics, but in Africa very few studies have been done, and the study that has been done, one was in South Africa, though we don't still have the statistics. But according to WHO, by 2010, they showed worldwide 35.7 million people had dementia, and they say the number will double by 2030, which they are looking at 65.7 million people. And they say the number will increase again by 2050, it will be at 115 million people having dementia. And this is a very big impact to the society, because if someone has dementia, it means they need a caregiver. And in our situation, being in Africa, how many people can afford to have a caregiver? So it means if you're working, you stop working to take care of your loved one. So it's like the number doubles. These are two people who will stop, one will stop working and to take care of a loved one.